Earlier this month, a CDC vaccine advisory committee voted to change recommendations for when babies should get their hepatitis B vaccine. And the new process has left some new parents with questions. So to talk us through what this means for families, we're here with the Chief of General Pediatrics at Children's Minnesota, Dr. Gigi Chawla. Thanks so much for being here.
Well, thanks for having me today.
Yeah, and really helping us navigate this. I know we have a lot of parents who watch. So we're all on the same page. What is hepatitis B and kind of the risks?
Yeah, so hepatitis B is a very contagious virus that's transmitted usually through blood and body fluids and can lead to a chronic infection of hepatitis B that is not curable. In many instances, it can lead to cirrhosis, prolonged and very difficult liver disease, and even death.
Wow, so some long-term effects there. So can you walk us through, now that we know what this is, what that change was?
Yes, so last week, the advisory to the CDC recommended, after looking at some research and science on deciding whether or not to continue the universal recommendation for hepatitis B vaccination at birth. After looking at both sides, that committee recommended that we no longer need to recommend that vaccine for hepatitis B at birth for patients, mothers who are hepatitis B negative with testing. They did continue to recommend that hepatitis B vaccine be given to babies whose mothers are positive or whose mother's status is unknown.
Interesting. Okay, and that was a decades-long recommendation.
That was
in place,
multiple decades.
Yeah.
I think the last time that this universal recommendation has been in place since 1991.
Okay.
And before that, this was the recommendation that we stratify parents based on risk and make the determination that for moms who were unknown or whose hepatitis B status was positive, that they're the ones whose babies get that recommendation. And what they found was that even with that hard work in place, that about 2,000 babies each year were affected by hepatitis B despite our best efforts. And that when we gave universal and made that recommendation for universal hepatitis B vaccine, we had a 99% reduction. So it's really unfortunate, and babies will be at risk because of this.
Interesting. So for families watching now, let's do the action. I mean, what are the risks and benefits for getting the shot at birth or doing it later in life?
Yeah. So the recommendation still is for babies whose mothers are known to be negative to get their hepatitis B vaccine at 2 months, 4 months, and 6 months. And what we want families to really strongly recommend or consider is the recommendation from all health advisory groups, whether it be family practice or nurse practitioners or the American Academy of Pediatrics or internal medicine, to really think about getting that hepatitis B vaccine at birth still. All insurance companies are still recommending that this be done because the science is so strong that there's been a 99% reduction in hepatitis B transmission because of this critical period at birth. And I think the reasons for it are really a couple. One is that you can't always predict when your baby is going to be born or the circumstances where your baby is born. And so even, despite mom's best efforts and thinking, I'm going to go into the hospital, I'm going to get my test, and if the test is positive or is unknown, then I'll get that vaccine. It doesn't always happen as smoothly as that. And so it continues to put babies at risk. So that's the first thing that I want families to think about. And the second thing is that birth isn't the only way that your baby can be at risk. Any blood or body fluid could potentially be contaminated. And what we know about hepatitis B, because it's so contagious, it can live on dried blood spots for up to 7 days. So the things that you think of as contagious, you may not be aware of all of the things around you that could be a potential risk for your infant.
Right. Thank you so much, doctor, for breaking this down and also giving us some insights about this change in recommendations. So thank you so much.
Thank you.
It's a tough topic. It's an important topic. We'll have more about this at care11.com/noon.